My name is Ingrid Katz, and I'm an assistant professor of medicine at Harvard Medical School and a physician at Brigham and Women's Hospital in Boston. This paper was a large, multi-site observational study to understand how women living with HIV could have detectable viremia at delivery despite initiation of highly active antiretroviral therapy. While there has been a large amount of research done on the prevention of mother-to-child transmission of HIV, there is still a gap in our knowledge of factors driving detectable viral load at delivery. This ultimately risks transmission of HIV to the newborn and impacts maternal health. We had a tremendous opportunity to examine data from a very large observational database that followed women over a decade to understand these factors that impact maternal HIV-1 RNA at delivery, to help researchers as well as clinicians identify who is at risk for having detectable HIV viremia at delivery. We found that 13% of women had detectable HIV virus at delivery despite receiving effective treatment during pregnancy. In most cases, this did not result in transmission of HIV to the newborn. However, long-term exposure to the HIV virus during pregnancy raises concerns about maternal health and also health of a newborn who was exposed to the HIV virus but may not have HIV themselves, since there are data now to support that newborns exposed to HIV in utero have worse health outcomes than those who have not been exposed to HIV. We also found that women who started treatment in the 3rd trimester of pregnancy were much more likely to have detectable viral load at delivery than women who started treatment earlier in pregnancy, with up to a 25% risk of detectable viremia at delivery. In addition, women with higher pre-treatment viral load, as well as women who were not on as potent regimens or who had difficulty adhering to the regimens, also had a higher odds of having detectable HIV viremia at delivery. These findings are important because they support the fact that antiretroviral treatment can only be efficacious if started early and that individuals are able to adhere to highly potent regimens. In conclusion, it's important to start women on the most potent regimens available and to provide support to adhere to these medications throughout pregnancy and beyond.